Hello, and welcome to today's program. Use telehealth to improve quality of patient care. My name is Diana, and I will be your host for today's webinar. Our program will be 60 minutes in length. The first portion of the program is presentation, followed by a question and answer session. Today's program is being recorded and can be viewed again via the on-demand version, which is provided free with every live program purchase. The person who registered for the event will receive notification on how to access it when it is ready. Before we begin, I'd like to take a minute to review the web conference platform. First, to ensure that you can see the content for the event, please maximize your event window. You can make the slides full screen by clicking on the button in the lower right corner of the slide window. Secondly, to submit a question, go to the Q&A box located in the lower left area of your screen. Type your question into the lower text box and press your Enter key. You may submit questions at any time during the presentation. However, please note that it is likely that your question will not be answered until the Q&A portion of the program. Thirdly, please adjust your computer volume settings and make sure your PC speakers are at the correct volume. You can also adjust the volume by using the control in the lower right corner of the presentation window. Lastly, please note that the streaming audio quality you experience is often related to your individual internet connection. If you are having issues with an inconsistent stream or buffering, please try closing any other applications you have open on your computer. If you continue to have difficulties, contact us by clicking on Tech Support at the top of the Q&A Tech Support box in the lower left-hand area of your screen. Type your inquiry and press your Enter key. You also can give us a call at 877-297-2901 or email helpdesk@beaconlive.com. Now, I'd like to briefly introduce our speakers for today. First, we have Linda Murphy. She is Chief Operating Officer and co-founder of Concierge Home Care. CHC currently operates throughout the Florida market, touching a daily consensus of over 7,500 seniors. Linda's full bio is included in today's presentation materials for your review. We also have Anna Maria M. Turano. She is Chief Marketing Officer for Cinzy. Prior to that, she worked as Vice President of Marketing for Stratus Video and led the effort to spin off the Telehealth division and rebrand the new company as Cinzy. Anna Maria's full bio is also included in today's presentation materials for your view. Finally, before we get started, if you look in the lower right-hand area of your event window, you will see a list of handouts where you can find a copy of the speaker's slide presentations. Please feel free to print for your reference if you don't already have a copy. We have also included a list of useful industry acronyms. With that, I would now like to turn the program over to our speakers. Anna Maria, welcome to the program.
Thank you, everyone, for joining us today. This session is designed so that you will be able to understand how technology, specifically telehealth and virtual visits, can supplement in-person visits that your agency and your practice already conducts. You'll also understand what are the do's and don'ts of effectively documenting telehealth visits to avoid compliance risks. And last, looking at your patient census, being able to discern who would be appropriate from the patient and family caregiver perspective for setting up an engagement via telehealth in addition to the in-person care that you deliver. Linda and I will quickly go back and forth across the different points of this agenda. Please feel free to use the Q&A to raise any issues or questions that you have during our session today. With that, we'll start with Linda talking about how she really categorizes telehealth as new home care. Linda, do you want to give us your philosophy on that?
Absolutely. From a home care perspective, we went out. Our agency is actually kind of in its infancy. We've been going for about 5 years right now, but we really wanted to create an agency that was wrapped around innovation, caring for people who care for people, and utilizing our abilities to make sure that we're inspiring our staff to really operate at the highest level of their licensure. So with that, over the last few years, we've really been early, inventors, I want to say, to some of the technology pieces that we do. So I think we try to really provide care in a different atmosphere using technology, culture, skills, expertise, really to the highest level we possibly can. So telehealth has been a part of our offering way before PDGM and COVID. We started integrating. We've always had telemedicine, but we really started expanding on how we could touch our patients more frequently and get better outcomes. And that was really the drive behind why we went out several years ago to really try to figure out how can we move the needle on rehospitalization to a level above what the national average was running. And we were finding ourselves, we have always taken care of the most acute of acute patients, and I was just having a difficult time seeing why that lever wasn't moving any further. And whole and behold, we discovered through our telemedicine and using some of our other systems that we had, that virtual visits were really working. So I went out on a search to figure out how I could do touch points at a more cost-effective way with all of our patients. Anna Marie.
Great. And Linda, you talked about, the search that you had for telehealth, how it fits in with the mission and the vision that you've been able to establish successfully at Concierge. I know at the beginning there was a concern about PDGM, and for many of us, PDGM kind of went to the back burner as COVID emerged as a key concern for agencies. Do you want to talk a little bit about the PDGM and how it also drove the use of telehealth in your agency?
Absolutely. Going into PDGM, we really started preparing, much like everyone else, almost a year out. So we knew that there was going to be some changes to our visit ability with our patients. We knew we were going to have to figure out how to do more with less. There was no question on that, and how to transition a model of care with patients where a lot of times our staff out in the field are paid on a per visit. So, of course, they want to drive visits, and a lot of times we feel like the more visits, the better our patients are going to do. So it was really kind of doing a whole culture shift on all of the team members to figure out, guys, how do we have magic moments with our patients? How do we really reduce the amount of visits that we're doing and the time that we're seeing patients but still get better outcomes? So coming into PDGM, we kind of stair-stepped ourselves in. So we started with telehealth back in June of 2018. So we had plenty of time to start looking at how we would apply televisits into our whole care planning from the start all the way through and answer some of those needs that we had. So we started both from a nursing perspective, and then we started looking at it from a therapy perspective. Is there a possibility that we could reduce in-person visits, increase touch points through virtual care, and actually get better outcomes? Lo and behold, we certainly, we had also inputted from in a lot of our offices. I had already started doing some using video and having clinical managers and other staff members working from home. So we had a whole platform for that as well. So as March came around, PDGM came through. It really wasn't a huge shift for us. We were already prepared, and kind of as we transitioned into a new payment model, and we had a lot of our processes already in place. by using virtual visits. We had kind of shifted into what we needed for PDGM, as well as having no idea that it was exactly what we were going to need once COVID hit in March. And it gave us the ability to really then see patients that weren't even comfortable with allowing staff to come into their homes. So it met our mission of taking care of people who take care of people, but it also it checked off PDGM as we were going into PDGM. It checked off for us moving into COVID, and really helped us deepen our relationships with our hospital partners throughout the state, because we were there ready and adapted and able to adapt pretty quickly to the challenges and meeting the needs that our communities needed for taking care of COVID patients. So as I go in, I'm going to move along here to pushing, I'd like to even talk about how wonderful, when I talk about virtual care and what we did, it wasn't really just a virtual visit. We incorporated a whole new communication platform. So we had the ability, as we went through and revamped all of our disease processes, to really align the care that our staff were providing in the home, the support pieces we were giving to our patients from a communication perspective that supported the education they were receiving from the staff members. So our protocols were all built around, we have text messaging education that reinforces the education that's happening on a regular basis with our patients. We have the ability to do assessments at different points along the continuum of care that we have with our patients. We were able to start doing discharge assessments prior to patients discharging. So it was able to not only enforce the education and training we were doing our patients, but gave our patients the ability to communicate in other ways back and forth with us, and really engage that we had great accountability going on with our staff, and really give that concierge level of 5-star customer service that we really wanted to give to our patients. So,
great. And I'm sorry, go ahead.
Sorry. No, you were good. As we were moving into, I'm going to turn over to Anna Marie at this point. Sorry, Anna Marie.
That's all right. So, as Linda explained, virtual visits as well as the messaging component and assessments of virtual care weren't just nice to haves during the pandemic. The pandemic really illustrated that they were must-haves, especially when patients were quarantined or when they or their family caregivers were trying to limit in-person contact with others, including home health clinicians and even other family members and whatnot. So in the example of therapy, given the need to observe social distancing, physical therapists have been using telehealth to help patients continue their therapy so patients don't lose the momentum of their recovery amid the pandemic. What therapists have been able to do, especially at concierge, is that they're able to help them manage through the exercises they're supposed to do, touch base with them, make sure that they're progressing in the way they can. And a virtual visit is the next best thing to being there, because someone could prop up their smartphone or their tablet and allow the therapist to visually observe them, walk across the room, walk down the steps of their house, etc., and see how they're doing from a movement standpoint. Now, it's not just about, the physical therapist interacting with patients who've had, say, knee surgery and whatnot, but there's also the patients themselves who've had COVID-19, and they may have a lot of fatigue, a lot of weakness, a loss of function, cannot necessarily do things the way that they could before. They could also have a lot of respiratory problems and a loss of endurance. And because of comorbidities, a lot of these problems are even exacerbated. So you have a person with a previous fall or injury, their balance is affected even more. And physical therapy is critical in those situations, and the ability to use a virtual care helps these patients continue to heal at home, especially if they've been discharged from the hospital, or in the case that concierge has been able to do, is relieve the burden on area hospitals, and for those patients who aren't yet the sickest of the sick, they can help recover and heal at home. So teletherapy provided in the home setting really allows therapists to better compensate for barriers to recovery. Now, if we look at the idea of more care and safer care, this slide illustrates how, especially agencies that cover rural areas, face challenges in reaching patients, reaching them in a timely fashion, being able to see as many patients as possible, and really virtual care helps improve and optimize the productivity of the clinicians at hand because they can see more patients more often versus spending the majority of their day behind the wheel. In the example of hospice, staffing remains the top non-COVID related challenge to the hospice industry in 2021. And, what hospice providers have been able to see in the past, say, 12, 15 months is that, unfortunately, they've had restricted access to hospice patients because of the COVID restrictions at facilities, homes, et cetera. And that reduced access impacts the interdisciplinary team from, bringing forth the in-person support for the patient as well as the family members. So as a result, chaplains, social workers, home health aides, the therapist, PT, OT, SLP, and even trained volunteers have been limited in their ability to provide comfort and compassion during these critical stage of someone's journey, if you will. And with virtual care, hospice providers now can reach that many more patients as well as their family caregivers, whether they're in major metro areas, suburban locations, as well as in these rural communities too. And using a virtual care platform, the family caregivers now have someone essentially on their side every step of the way so that they can be coached on how to manage the pain, the symptoms, et cetera, that their loved ones are experiencing. And, it's not just a phone call, right? It's really having someone almost there, but via video that someone can tell them how to administer the pain medication, how often to do it, walk them through it so they feel that much better that they can do the right thing for their loved one. At the same time, it obviously reduces the stress that the patient, the family caregiver, are putting on the healthcare system because in a lot of situations, the family caregiver may unfortunately say, do I go to the hospital? Do I go to the ER? Or even ask the home health agency, can you send the nurse out for a visit, which could take half an hour or it could take an hour and a half or even more to get there, especially after hours and on the weekends. And now with virtual care, they're able to get that support, what they need on demand, and that interaction. And if something escalates that, someone needs to go out there for whatever reason, it can happen. So in-demand care and impact. When we think about, who is really using the healthcare system, there was something that came out today that, individuals living with chronic diseases really account for 88% of the hospitalizations. And we all know that that's not a surprise, unfortunately, right? Approximately 133 million Americans which is about 40% of this population here, have a chronic disease. Almost a third of the population is now living with multiple chronic conditions. And it accounts for the majority of the healthcare spend in our nation. So according to the CDC, it accounts for approximately 75% of the nation's aggregate healthcare spending. And advancing the care of chronic disease is critical. And one way to do it is making sure that there's a virtual care platform that connects clinicians, colleagues, other medical professionals, interpreters, as well as the patients and the family caregivers to drive engagement, to drive medication adherence, to make sure that they're attuned to, the lifestyle adjustments, the diet, the nutrition recommendations that they should be following on a regular basis too. Of course, the increasing aging population is really placing a great burden of care on home health agencies. And many agencies don't have specialists on hand to face or to help patients with some of these chronic conditions. So whether it's a diabetes specialist, whether it's a hospice provider, whether it's a wound care nurse, these specialists can really be brought in via virtual care if they're not always available to, in person, make that visit along with a clinician or instead of a clinician to make sure that the patient gets exactly what type of care that they need. Couple example use cases. I talked already about some things such as, therapy. I talked about, the wound care idea, talked about, some of the chronic conditions and hospice care. But you can see here that there's a whole host of use cases that virtual care can apply to. And what I'll do is kind of, bring you to actually the upper left-hand side and the lower right-hand side. So the upper left-hand side is all about the welcome message, and an agency such as Concierge uses this effectively to introduce themselves to a patient, and a lot of times before the patient is even discharged, that they have a video call with the person who is going to be coming to their home, as well as conducting virtual visits going on, and it establishes that connection, that emotional relationship up front, and then the welcome message just reinforces the agency that's going to be connecting with them, as well as what they should be doing or expecting, especially if they've just been discharged from the hospital within the first, say, 24 hours of their care at home. Now, the lower right-hand side, there is the emergency side, and Lynn and I actually both reside in Florida. And, in addition to COVID and Concierge sending out messaging that's all about, making sure that people are aware of the precautions they should take to protect themselves from COVID, there's also, unfortunately, hurricane season, which is upon us in Florida. And what Concierge has been able to do is send out messages to their census immediately at once, informing them a hurricane is approaching or it's in the forecast, and reminding them to make sure they have their medications on hand, food on hand, etc. And this helps them really efficiently use their man hours. What used to take, hours for people to call every single patient by phone, now they can immediately inform them of what needs to happen. And then, of course, with the virtual visit component is remain in touch with people and continue to provide them care if, God forbid, the hurricane means that one cannot get to someone's home or to perhaps the facility because of road obstructions and whatnot. Here's a couple examples of what the messaging looks like. So from a welcome message standpoint, as well as discharge instruction reminders, etc. And you can see there's a whole host of messages that with a virtual care platform, an agency can set up, can cascade, can schedule the appropriate time, as well as the patients who should receive it. And, the beautiful thing about, say, the Cincy platform is that we have integration with interpretation and translation. So, there's a significant portion of our population here which is considered limited English proficient. And that means that English is not necessarily their primary nor preferred language. So how can you communicate? How can you engage patients who aren't comfortable speaking or communicating in English with you? Well, it's actually via virtual care, that you could bring in an interpreter into the call, as well as you could have the messaging translated so someone, can truly understand exactly what you're trying to do for them from a care standpoint. So here's a couple of messaging examples for a pre-op, pre-procedure. I'm not going to read through this, but it gives you an idea of kind of, the friendly tone, the idea that you're here for them, that you might have some questions, etc., before your procedure that's coming up. And here's a way to, again, easily click and get in touch with your clinician if there's a question you have. I'll talk a little bit about one specific use case, which is COPD, and I'll keep it quick. When we think about patients with advanced COPD, actually 1 in 5 patients are readmitted within 30 days of discharge. And virtual care really helps them stay at home, helps them with their breathing exercises, helps them adhere to medication, as well as remain engaged in their care, thus improving their quality of life, right? Because they're not going back to the hospital. We don't want them to be the frequent flyers, the frequent users of the hospital system. So UAB in 2019 actually conducted a study about the use of virtual care with patients who are living with COPD. And what they found is that by engaging patients virtually, they were able to reduce readmissions by roughly 200% in 30 days. So their 30-day all-cause readmissions dropped from 18.1% to 6.2%. And they obviously expanded it beyond COPD into other chronic conditions and whatnot. And home health agencies really play an important role in supporting hospitals. So much like Linda said, they're the referral partners, right, in addition to physicians and practices and whatnot. And keeping them happy means being able to show them the data that you're on their side. You're all in this together to keep the patients at home and, as healthy as they can be and improve their quality of life. And virtual care is definitely a way that one could do it. Little quick going through, if you look at a COPD messaging cadence, so say the first 60 days upon being part of the census with an agency, you're not necessarily bombarding them, if you will, with a new message every day, but, it's every couple of days, and then perhaps in the second 30 days, it's maybe once a week that there's a message about their condition, about diet, exercise, about the role of medication, et cetera, to drive adherence. Here's some examples of what the messaging and patient touch points would look like. And with the virtual care platform, you can also have this messaging sent out to the family caregiver as well. Or sometimes, instead of the patient, if the family caregiver is very heavily involved with the patient and needs to, make sure that they're on top of that patient's care as well. And then the example benefits of virtual care are many. We talked a lot about minimizing the ER visits and readmissions, but there's also, the important aspect of, in the upper right-hand corner, the secure communications, making sure that it's in a HIPAA-compliant manner so that what is being exchanged is encrypted, and also reducing any risk that your agency may face from any breach of PHI and HIPAA.
So going back to that last slide, I really want to emphasize the diamond in the mix, and that really is the higher quality of care that we're able to provide our patients. And I can give you example after example, and even as recent as last weekend, thinking about we've added virtual touch points on our Fridays and Saturdays for a lot of our bundled our alternative payment models that we work with the hospitals. Again, they were so excited to have a partner that they knew and were confident that we would be able to provide the touch points that we said that we would on these type of patients. And as we all know, when you can do that check-in on a Friday or a Saturday on a patient that's been recently discharged, it really enhances your opportunity to be able to keep them at home and keep them on track for what we need to do to prevent a rehospitalization. It allows us every weekend on Mondays we go through our weekend on call, and one of the first questions I ask is we've recently incorporated our virtual care team into our on-call process. So all of our patients go straight to a triage process with our on-call virtual care nurses. And I look at how many times are we now able to meet the needs of our patients immediately, get on a virtual face-to-face visit with a patient, walk them through their IV complication that they might be having because as they were learning how to do their IV, they forgot to unconnect, or unclip to open up the IV catheter. Or, we can take a look at that knee that they might be concerned doesn't look as healthy as they think, and we can say, no, it looks exactly the way it needs to be, and we don't have to send out a nurse to see that patient, and the patient gets an immediate response from our team and frequently is like, this is wonderful. We have an immediate nurse at our side at any moment when we need them. And it just gives us fewer setbacks and less rework. It really, our patients are progressing. We're at a point now, even from a therapy perspective, to ensure that patients from a therapy perspective, from visit to visit, are following through with their exercise program, or they're following through from an occupational therapy or speech therapy perspective on the exercises or the program that's been laid out, or the plan for that patient, so that they can actually process through that even faster and get better outcomes. I'm going to turn back to you here, Anna Maria.
Thank you, Linda. So these are some quotes actually from patients as well as their families in terms of using virtual care. And you can see that there's a lot of satisfaction as well as there's a lot of joy and there's a lot of relief that comes through in these statements. This especially, surveyed while everyone was in a quarantine situation. People were just, dazzled by the fact that, the agency thought of them, thought of the concerns that they would have in terms of in-person visits, and made it as easy as possible to engage them and continue to treat them virtually in addition to the in-person visits whenever they could manage it. So as Linda has pointed out, what Concierge does is position themselves as saying, what we offer also is this VIP aspect with the virtual care, and it makes everyone feel, that much more better. And it's not just the perception, it's truly the reality, starting with the welcome message and going all the way through the episode of care. Now, if we look at the clinician feedback, it's also equally positive. In the case of Concierge, they started using virtual care in Cincy in advance of the pandemic. So because of the PDGM implications, and they want to minimize that impact on their agency. And a lot of other agencies have done that as well. There's other agencies, obviously, who their eyes opened up because of the pandemic, and they recognize the need for virtual care. And it's fascinating because everyone says, gosh, what we're seeing is that the patients want to engage with us this way. This isn't actually a hardship for them. And also, when we think about the communities that the home health clinicians and providers serve, yes, everyone says, it's the seniors for the most part, but their level, their grasp, their adoption, their usage of technology is up there. And it's, rare at this point to find someone without the smartphone, without the tablet, or even a family member who has them, to keep them engaged virtually with the care that an agency is providing. So, Linda, I'll turn this over to you to talk about how agencies can get started in telehealth and virtual care, some tips and ideas, et cetera.
Absolutely. And I always say, learn for those folks that had implemented, because when we first started to implement telehealth and virtual care, we did a trial and error. I honestly, when I talk about, I thought my nurses would be thrilled about having an idea of being able to stay home one day and do virtual visits. But it was a little bit of a shift. And over the years, what we have found works really well is we actually have a virtual care team where they're truly dedicated and they understand, and it's a skill set that you do. So we have an entire process that works from a compliance perspective all the way through, ensuring that we have orders on the get-go for the virtual care that we're going to provide. We tie that into the care plans and the protocols that we do. We have champions in all our territories that really do believe and understand how they can help a patient get through virtual care. And we actually even have a few members on our team that can take the most, technically challenged patients out there and teach them how to download an app on their phone and be able to use telehealth in ways they never thought they could. So we really did a buy-in all the way around. We have a full team, and currently we do close to 2,000 virtual visits on a weekly basis across our clientele and our patients, and we're looking at other ways that we can expand that, and how can we even further use a communication platform to enhance our customer service that we're providing our patients. We follow through, we track. I track not only my average visits per week, but my average virtual visits per patient. And we have goals to set up on that to ensure that we get the outcomes that we're looking at for that. There's been a lot of focus, as folks may, as you know, there was a lot of focus for us too on how to document telehealth visits. And our telehealth visits are very comprehensive. We have a time requirement to make sure that we're really accomplishing the pieces that we need to with those televisits. We've been super excited that some of our commercial insurance providers are seeing the value in those telehealth visits and starting to reimburse for those. I think there are some commercial payers out there that are looking, and they understand that these touch points really do make a difference, and they reduce the overall cost when you can prevent rehospitalizations and sometimes prevent those in-person visits as well. So it's really, you have to have a solid, implementation program. Whatever program you decide to use that's going to provide that virtual care and that platform for telehealth, it's really, how do I operationalize that, and how do I use every aspect in that, from your daily case conferences to the way that you analyze the care that you're providing, to the additional education and support you provide the clinicians that are out there providing those telehealth visits, how you document that, how you document those on your plan of care to make sure that you remain compliant all the way into the delivery, and how a patient receives that on the other end. As I mentioned earlier, the OIG is really now, with COVID and with the expansion of telehealth services across the entire continuum of healthcare. Obviously, from a home care perspective, Medicare does not provide reimbursement for telehealth visits at this time. I do think there's some thought process down the road, and there's a lot of talk and legislation that's going on, because there's a lot of folks out there that are really realizing this does make a difference, and what's the opportunities there for Medicare providers. As I mentioned earlier, in a lot of our shared savings alternative payment plans, there's opportunity in shared savings, and telehealth is a way that you can reduce your overall costs but still get better outcomes, so that can help. So, but we are very, I want to say, compliant from a perspective in how we do document those telehealth visits and make sure that we have orders for those, and that we have an audits put in place to ensure that we're compliant on every aspect.
So home health agencies may struggle with understanding the benefits of technology adoption, especially as we hopefully move out of the pandemic and try to get back to, quote unquote, the real world, if you will. But now, as Linda pointed out, as I pointed out, the idea is that it's really about easing and expanding access to your patients about the critical care that your agency, that your practice provides on a regular basis. And there's a downside of not implementing a communication platform. And it would actually weaken an agency's positioning as well as performance amongst your patients, their family caregivers, as well as referral sources. Because a home health agency can use a virtual care platform for a whole host of reasons. First of all, to allow them to address patients' questions and issues in a more timely manner, as well as driving that deeper patient engagement on a day-to-day basis, especially when they're first on census and after they've been discharged from a hospital or other facility. And of course, we're hearing more and more about the SNF at home model and the idea of choose home. And what virtual care does is that it enables an agency to really position themselves for that that referral situation from a hospital that would typically go to a SNF and now can go to a home health agency, knowing that the home health agency can essentially wrap the patient with the care as well as the technology they need, including remote patient monitoring, to keep the patient aging, healing, and recovering at home. So there's a lot of great opportunities on hand for a home health agency and a practice to use telehealth. And this kind of goes back to the idea of, what is, the triple, if not quadruple aim of healthcare, and how can telehealth happen? How can it help, drive the achievement of it? Of course, obviously, with the triple aim, it can help achieve improving the individual experience of care, improving the health of the populations that we all serve, as well as reducing the per capita cost of care. But there's also that quadruple element of, aims of healthcare, and that's the idea of clinician satisfaction. And what we're seeing is that agencies are happy to bring on telehealth, not just to increase the patient and family caregiver satisfaction, but also realizing the satisfaction from their clinicians. And that obviously comes through in terms of their ability to retain top talent as well as recruit top talent from other competing agencies, as well as other stages of one's nursing career too. So the next two slides give a little highlights of agency executive feedback. So these are, in the C-suite of various agencies that Cindy works with, and you can see, there's a significant decline in the hospitalization rate out of the gate from 11% to 4% that Accent Care has been able to see. Also, Genesis Home Health, when they changed their secure messaging platform to Cindy, they were able to immediately see within 5 months that they've been able to prevent 23% rehospitalization. So you can see that there's the results. It's not just a nice to have anymore. It's truly a must-have to round out all of the innovative and impactful care that agencies are providing. And here's some other examples, some other stories from essentially, C-suite as well in other agencies of different sizes across the world too, across the nation. So the idea of, critical, meaningful aspects in hospice care, as well as during the pandemic, especially during the unfortunate high/low points of the pandemic, as Linda pointed out, being able to use assessments, being able to use return-to-work virtual surveys to daily keep track of how your staff are feeling, what are their symptoms, et cetera, to make sure that they're also, at the best of their health and mitigating the risk of potential infection and transmission amongst colleagues as well as patients and family caregivers. So Diana, I'd like to turn this over to you for questions. Before we do that, Linda, are there any final comments that you'd like to communicate, share about your experiences and insights with virtual care?
No, I appreciate everyone's time today, and hopefully this has been helpful. I can tell you one thing, I am so grateful that we went down this avenue, and I can't imagine providing care today without our virtual care platform. It's really enhanced everything that we do, and in an aspect, it's really helped us maintain and, if anything, really grow our business, especially during the COVID-19. So I'm looking here as we're talking, and I'm starting to see some questions come through. So I might just address the first one. It says, Are you able to obtain reimbursement for telehealth? What arrangements do you have in place with referring partners and/or payers? So at the moment, from a Medicare perspective, no, there is no reimbursement for telehealth. And if you're not aware, there is some work going on and legislation going on to try to see if we can get reimbursement for telehealth, or even see if we could apply those towards the LUPA rates. I'm not sure what we're going to see or come out of that, but at the moment it's not. Even for our Medicare patients, I still would not give up the opportunity to do telehealth because we're able to incorporate it and really put a plan together that meets the patient's needs more cost effectively. The question about what arrangements do we have in place, we do have an arrangement with some of our commercial providers, one commercial provider in particular that does reimburse us for telehealth visits. We do get authorizations for those, and we get those included into the authorizations when we're providing that for patients. We also utilize telehealth check-ins for on our first 2 weeks for one of our large commercial providers, where we provide additional telehealth visits on a Friday check-in, Saturday and Sunday visits for the first 2 weeks after a patient's discharged. And again, that eliminates the ability of having to do those visits in person. We do them by telehealth, and we find we get the same, if not better, outcome because we're able to touch the patient on all 3 days. Now, it does give us the opportunity, if a patient is decompensating, that we can get out there and we can get the patient's needs met more effectively. Anna Maria, if you're okay, I can take the next question as well that I'm seeing here that says, have you been able to use virtual visits to complement and even replace in-person visits for PT and knee replacement patients? Super excited about this. To be honest, when we were approximately a year and a half ago, almost 2 years ago, in one of our territories, the largest orthopedic physician was looking to going to a full virtual follow-up therapy perspective. We live in Florida, and they were looking at contracting with a company out of California, where they were actually getting rid of all in-person visits and doing everything virtually. Well, you were fortunately allowed to come in, and they were on a bundle, so we were able to work with them and do a mixture of in-person and out-person and virtual visits, in-person and virtual visits. And I'll be honest, we were able to get a fresh knee done in 3 in-person visits and 3 virtual visits with the same outcome that we used to get, with our typical 10 or 12 visits that you were doing for patients. I bring this up, just to reinforce. I think if you've been in home care long enough, you remember the days where there was no possible way you could do a fresh knee in under 18 visits. Then we have to get down to 14 visits. Then we have to get down to 10 visits. And now if you're part of any bundle projects, you really have anywhere from 4 to 6 visits to get that patient up and moving around and discharged. So again, we've been able to incorporate virtual visits and meet those quality outcomes. Sorry, I'm trying to move further down here.
In the meantime, for everyone who's dialed in, please feel free to use the Q&A feature and type in the questions that you might have.
So I'll hit the next question too. It says, how essential is the role of your internal virtual care telehealth champion at Concierge? And I would have to say my program would not be successful without I have a director of telehealth that manages, trains, educates, holds accountable, works with their virtual care team, and our virtual care team now is getting close to 30 strong. So it does become its own team, and these folks are so well trained in identifying what's going on with that patient. And I'm telling you, on a daily basis, is preventing rehospitalizations from their ability and their keen sense to be able to understand the patient and really even dig in further than maybe a nurse that's in the home that's being distracted by all the thousands of things that are going around. So you'd be very surprised when you've got very well-trained virtual care nurses, what they can dig in and uncover and really help that patient progress to. Another question, how do you position telehealth with patients and their families, caregivers? When or where do you bring this up, and how do you make sure they're on board with the technology? We actually incorporate the process into our sales process, and our liaisons that are in the hospital. Now, we know in COVID we've had a little bit more trouble getting to the patients at the bedside, but our number one goal is really to meet the patient at the hospital and incorporate telehealth right from the bedside. So we get them set up on their app. We'll do their initial welcome call right there from the bedside with the patient. It really helps us engage the patient and let them understand they're moving from an acute phase of care into a post-acute care, and that really this technology that we're using is here to enhance that care that they're going to receive at home. Patients get super excited about it. I go back to using an example. Even our clinical managers like to do their welcome calls through Cindy and through that virtual call with their patient. And I was sitting in one of the offices, and I was hearing a patient call in through our app process, and our clinical manager was answering. And here was the patient just wanted to call into their clinical supervisor to let them know how great their nurse was and how well their leg was healing. And she's bringing the phone down to her ankle and showing the clinical manager she was so excited. Look at my ankle. Look how good it looks, and how great your nurse has been. So it really it brings your staff members that really have been managing their patients from afar, that now have a face, and they can really incorporate. A clinical manager frequently doesn't get to see that patient. They're managing the nurse that's seeing that patient, and now they actually get to really see and be part of the exciting piece of what we do, and that's really caring for patients and getting them to that next level. How do you measure success, and what has been the impact of satisfaction, outcomes, and referrals? Well, I'm very proud to say that we are 4.5 to 5-star ratings in all of our agencies. Likewise, with our outcomes, we've seen our HCAP scores go up as a result with I have to say, it has to do also with our telehealth and our communication platform. I think anyone that's been in home care as long as I have or longer knows that the number one complaint you usually have from patients is communication and not being communicated with. And this gives us the ability to communicate in many different avenues. And even from a clinician, imagine the time that we take. We require our nurses and our staff to communicate with their patients the day before to let them know that they're coming out to see them. But they, as a clinician, can send text messages to their patients and notify all their patients in 5 minutes on the day before to let them know what time they're coming out to see them the next day. So again, as we take care of people who take care of people, we've now enhanced the way that our clinicians can communicate with their patients. It's more cost effective and time effective for them. And then likewise, then they can immediately communicate with their patients. And again, that satisfaction of a patient calling into an on-call service to be able to immediately contact face-to-face with a nurse gives them better outcomes and gives them better satisfaction. What are your next question? What are your expectations for expanding the use of telehealth at Concierge? We, as I mentioned before, we have set goals and that we have set for each of our offices on even the percentage of telehealth visits that we do as a bigger part of the care that we're providing to our patients. My expectations are that we continue to reduce our rehospitalization rates, that we really partner with folks. Super excited about expanding our virtual care nurses into our on-call process and our centralized on-call pieces. So it's really just an ongoing we are a growing agency, and we've done several acquisitions over the last year. And I can tell you it's been very well received when we go in with our acquisition teams and new teams that haven't been using telehealth, and how quickly they're able to adapt and excited about incorporating this. And we see literally, 30 to 60 days, we are seeing better outcomes. We're seeing reduced number of in-person visits, but increasing the amount of touch points that we're doing. So we know that we're financially being able to adapt more to the PDGM and give the patients what we should be giving them in order to get good outcomes. So it's really just a continual expansion. I can't imagine, again, as I said earlier, providing care without some type of telehealth platform. I think, is there any additional questions? Anna Maria, do you think, did I miss anything on any of those questions that you may want to give additional information on?
So, Linda, I think you thoroughly covered everything, and it's all about the patient experience, but more importantly, it's the outcomes, and the outcomes are first and foremost the patient, being able to stay at home, reducing the rehospitalizations, improving their quality of life, as well as enhancing the care they receive. But then it all, kind of trickles down from there to the outcomes for the clinicians, for the agencies themselves, and of course the referring partners too. Thank you, everyone. We really appreciate the opportunity to share our experiences and insights with all of you today. And thank you, Linda, for co-presenting with me. It's been an honor.
Likewise, Anna Maria.
Thank you, ladies. Ladies and gentlemen, we have run out of time. In closing, we want you to know that your feedback is very important to us. Soon, the person who registered for the program will receive a post-program email. The email will include an evaluation link. We hope you will distribute to all who listened in your group. We would appreciate it if you would complete the evaluation at your earliest convenience. Please note that the post-program email will also include a link to watch the on-demand version of this program. And now I'd just like to turn the program once more over to Linda and Anna Maria if they have any closing comments.
No, I really appreciate everyone's time today. I hope this brought some information. Feel free to reach out to me. I don't know if we've got our email addresses on here, but I'm more than welcome to answer any additional questions anyone might have.
And I hope that this has inspired everyone to think about the future of care, and as Linda said, evolving the agency from old home health care to new home health care.
Thank you. Ladies and gentlemen, I'd like to thank our speakers once again for joining us today and sharing their knowledge on this topic. And to our listeners, thank you for putting aside so much valuable time to watch our program. We look forward to providing you with other helpful programs in the future. Ladies and gentlemen, this concludes our program. Thank you again for joining us. Have a wonderful day.